Here's a closer look at options for families with a hereditary condition. If your family is identified as being at risk of having a child with a hereditary condition, either chromosome abnormality or single gene disorder, there are some options on how to address this risk. Some couples choose to conceive naturally and opt for a diagnostic test within the pregnancy to find out if their baby is affected, while others conceive naturally and decline prenatal testing, waiting until after delivery to know. In both scenarios, the risk for the baby to be affected is the same. Also, there are reproductive options that can minimize or eliminate the risk of having a baby with one of these conditions. In vitro fertilization with pre-implantation genetic testing, also known as PGT, allows for a significant risk reduction.
Approximately 98%.
There are different subtypes of pre-implantation genetic testing depending on what the embryo is being tested for. PGT monogenic test for hereditary single gene disorders like cystic fibrosis or Huntington disease. PGT structural rearrangements test for chromosome rearrangements like a translocation
Or inversion that is hereditary.
Lastly, PGT aneuploidy tests all 46 chromosomes looking for chromosome abnormalities that are not hereditary, like Down syndrome, but that could alter implantation and pregnancy rates. To do this, doctors remove the mother's eggs and the father's sperm to create embryos outside of the body. The laboratory then performs genetic testing on the embryo and implants only the embryos that are predicted to be unaffected into the mother. In this scenario, the baby has minimal risk to be affected. Once pregnant, diagnostic testing is recommended to confirm PGT results. Other alternatives include opting for a male sperm donor or a female egg donor, which would remove the risk of passing on the hereditary disorder. However, the child would not be 100% biologically related to both parents. Lastly, some couples choose to adopt or elect not to have children. There's no right or wrong answer when it comes to dealing with hereditary conditions, but rest assured that with Northwell, you have a team dedicated to providing you with the tools you need to decide what's right for you and your family. To learn more, visit northwell.edu/genetics.